I'd like to acknowledge the local custodians of the land in which we meet this afternoon and honour elders past, present and emerging. I'm Melissa Wilkinson from the education team at the Hunter New England Central Coast Primary Health Network. Welcome to the first day of spring. Weather's beautiful and wishing you all well out there and safe. Just a little bit of housekeeping. There will be a poll at the end of the session. We strongly encourage you to complete that. The feedback's really vital for us to plan ahead for further education events like this one. And also we are being recorded today, and a copy of that recording will be available in the Education Library on our website. If you have any questions, we'd love you to pop them into the chat box. Take this opportunity to ask any questions that you have. And I'll introduce our presenter today. It's Alison Lees, and welcome. She's a PCIO with the Hunter New England Central Coast Primary Health Network. Welcome today, Alison, and thank you for presenting with us. I'll hand over to you now.
Thanks very much, Mel, and thanks very much everyone for joining today to talk about how you as a colleague, a supervising GP, a practice manager can support the success of registrars that might be already in or coming into your general practice soon. As Mel said, my name's Alison Lees. I've been with the PHN for about 3 years, moving into my 4th year soon. I've just recently moved into a vaccine and capacity tracker project role, but before I did so as a primary care improvement officer, I met with a practice owner and GP team who seem to very successfully attract and retain registrars or overseas GPs into their practice. So I met with them, and that's they've contributed to this, and also people in workforce relocation and our own workforce manager have contributed to this as well. So thanks to all their contributions. We're going to talk about some methods that have been proven to enhance a registrar's experience in general practice, some easy and practical ways to add value to a registrar's experience within your team and in your community. And we'll also look at how these approaches and activities can contribute to your practice, maximising its appeal to registrar applicants in the future, which will help sustain the primary health workforce across our region. So thanks very much for coming along today. The learning outcomes will also include how to help registrars access local health referral pathways, how to help registrars navigate the health topics that are of interest to them and that will help with their engagement in your practice. Also, we're going to look at some tips to support registrars with MBS billing, their confidence with billing and their access and good habits of accessing the MBS descriptors and avenues that you can use to support registrar wellbeing and mental health. As well as some GP tips for optimising the registrar experience in practice, and as I said before, how this has helped their practice establish a reputation as a practice of choice among registrars submitting applications. So some of this you will be familiar with. I certainly hope by now that most practices are familiar with our health pathways. And one concept to support your registrars is that with their orientation or induction in your practice is that you can actually include this and get the registrars to save this as their favourites and promote it as potentially a first point of accessing information for the patients that they're seeing in practice. So the PHN have provided so that the local health referral pathways and health information can be at the fingertips of all your clinicians, including your registrars. The health pathway site are password access due to the clinical nature of the content. We do also have a portal for patients, which will be good for your registrars to know about, and that does not require a password. Both of these sites can be relied upon for relevant information, and especially for the COVID-19 pandemic and vaccination updates that are just about daily and have been really relied upon across the nation for the last year or so. So I'm sure that your registrars would be very grateful to know about these in their orientation. And if you don't already have it as part of your orientation pack, then we certainly would recommend that you would include that. Again, similarly, SENT referral pathways, most practices know about that, but that's not to say that the registrars have good induction of SENT referral pathways or know that they can come to the primary care improvement team or our own digital health team within the PHN for support and more information. So just a quick recap. The SENT e-referral allows referring clinicians to send secure electronic referrals to both public and consenting private specialists and allied health. The PHN and Hunter New England Health have partnered on this project to improve the way that referrals are received and processed, and this supports senior referring practitioners safely deliver the required information to the right service and enable accurate and prompt patient triage. So the PHN funds general practice by funding the supports general practice, by funding the purchase and installation of the software, and provides the initial training for eligible users, including your registrars. So certainly we would encourage any practices with registrars onboarding to reach out to the PCIOs or the digital health team. The resources and information can also be found on our website, which has been recently upgraded for those who haven't already accessed that. So how to help registrars navigate the health topics that are of interest to them, and that will help with their engagement at your practice. Of course, if you're letting them know about our education events, then they're going to know that you are invested in their experience as a registrar, but also at your practice as well. So the PHN's education events provide a regular up-to-date education that is extremely valuable for any registrars. And again, we would say get them to save this education in their favourites so that they can access local and region-wide CPD and education events. If they have missed out on an event or would like to access previously recorded events, the registrars can access, or anybody can access, the registrar's education library. Which would be good if they're wanting to stay on top of or access and catch up on any particular topic that they're interested in. So I've just got the link up there. So under the programs tab in the PHN website is the primary care support section. Most of you will be familiar with the primary care improvement team, and we partner with practices to build a better Australian primary health system across our region. We understand that general practice are the cornerstone of primary health care and are an invaluable part of the communities that we live in. We really want to see that you've got a practice that is attractive for incoming registrars and that they want to come back to your practice. And to help you, we've got a suite of resources that encompass patient experience, care team wellbeing, population health and business efficiency. And under this primary care support area, we've got focus areas covering topics including practice management, MBS, accreditation, mental health, diabetes and heart health. And so when you're doing an interview with your registrars, you might be finding out what health topics they might be particularly interested in. And please, if you find out that they're interested in any of these focus areas, we encourage you to navigate the focus areas and help them find what they're looking for. I don't know in what ways they might be able to apply this information for their own studies, but certainly in practice with their patients and contributing to your team, they'll be wanting to know about these sections. There's a wide variety of resources there. Please reach out to one of your primary care improvement officers if you would like assistance with any of the topics. And each focus area also has a community of practice, which provides a platform for people to connect and share their knowledge and experience. And what a great place for a new registrar to start if they're interested in any of these topics. So MBS billing, and as a primary care improvement officer in visiting general practice, you know, whether it be from practice managers or GPs, there was frequently inquiries about MBS billing, compliance, interpretation of the MBS item number descriptors and so on. So there's some really great ideas on how practice managers can support registrars in the practice management toolkit. And some other tips that we've heard about include using item numbers on the appointment types to help with familiarity of MBS item numbers, saving the MBS online in favourites, providing education to registrars and clinicians about rejected billings, the reasons for them and how that impacts on the practice. The PCOs are a wealth of support, and their many resources include a recently developed combined billing resource and one for chronic disease. There's also one, I think, that has been finalised that maps out a lifespan of health assessments and related item numbers. And that's just a great guide to help broaden the knowledge, I suppose, and confidence with billing item numbers and when it's appropriate to use them. So please reach out. That information is there for you. So the specialised mental health and wellbeing support for registrars, but your whole team and your family and patients as well can access some of these. These have been previously distributed and shared in other mental health webinars, but I'll use this as a reminder to say please keep these resources handy. You don't know when you yourself are going to need them or when you might want to have them ready to hand out to registrars. And some of them are specific for health clinicians, the doctors promotes the health and wellbeing for doctors and medical students across the nation. And Craner Plus do support remote health workers and their families. So there's a few there, and you'll be able to access these slides later on in the education library. We can also email these out to you actually, and I've certainly handed out plenty of flyers with these resources on to practices, so that's just a good one to keep in mind for yourselves. Okay, so some proven strategies. And I spoke earlier about an interview with a practice owner and GP, and that was Casey Sullivan, who did plan to join us today but was unable to attend. So I have got permission to share this information to the participants today. So a GP's tips for optimising the registrar experience in practice, and how this has helped them establish a reputation as a practice of choice among applying registrars. So one of these things was to use the initial interview with applicants to really promote general practice as a career, as opposed to doctors who might continue studies to work in the tertiary sector or specialise in different ways. You will know some of these, but the interview included talking about, you know, the lifestyle that being a general practitioner might offer. And I know that might be a bit funny to hear at the moment in the middle of COVID outbreak and vaccination, but that aside, you know, they spoke to, so Casey Sullivan would speak to applicants about the lifestyle that general practice can offer. And the variety of work that's involved in general practice, the benefits of having a better balance for family and relationships, and sometimes there's less on-call commitments that are available for GPs as opposed to those working in a hospital setting. Another tip that I thought was very beneficial was that they would screen applicants for those who indicated their interest to stay in an area, like a rural or remote area, long term, and often preference those applicants to come on board with them and their team so that they know that they were meeting workforce need in our area, whether or not they stayed at their practice, but that they would stay in a rural, remote area. Other strategies that you might find helpful was to have a look at some of the barriers and challenges that might exist with applying registrars or GPs in coming to your area, and that might include accommodation. So many registrars have found it hard to get accommodation in our areas. Sometimes that's because of lack of accommodation being available, lack of short-term leases, and a lack of rental history. So look beyond the normal real estate markets into the Airbnb market might be an option. Those short-term accommodation sites, and some practices it might be viable that they actually purchase accommodation, or the business might purchase accommodation. So it's just thinking or acknowledging that challenge and trying to find a solution for your incoming clinicians. One of the things that has been mentioned is that whether or not this applies to registrars or not so much, but certainly doctors who have previously been on contract or previously been employees who are now on contract often find themselves with really large tax debts. So being able to add value in conversation with these registrars by talking to them or letting them know at least that there are trained medical accountants that can support them and minimise the chance of getting tax debts and obviously maximising their income. Things like that would really, that any staff member would be really grateful to know about, that you're sharing that knowledge that you know, having been in the industry for a while. Whether or not it's viable, certainly by paying a higher percentage as an incentive for doctors to remain at the practice might be an option in comparison to other practices who might be paying the standard rate. The other thing to consider that would be really valuable is to look at the ways that that you can support your registrars or anybody coming to your practice enjoy the lifestyle that your area offers. Like what's happening in your town and region that would really add value and help them enjoy their experience. These are things that you might already have in your orientation or induction, but if not, then have a little think about how you can package that up and certainly include it in your conversations with the registrars so that they know that you are interested in them having a good time at your practice and in your communities, and see how that evolves for you. So other strategies in the teaching that Casey Sullivan shared with me is that with the registrar's orientation or time in the practice is that they make sure that there's a good relationship established between the practice manager and the registrar or new doctor, and that there is transparency across the pay that they get, how their bills calculated, how the office operates and how the whole team works together. They want to make sure that their registrars and doctors have felt confident that they could, if they wanted to, start their own practice one day, and rather than seeing that as a threat, they've found that actually has really helped with that transparency has helped with trust and loyalty with their staff. So I'd be interested actually to find out other practices' experiences with that. And the other idea is to use your networks and your connections and presence with other organisations, whether it be universities or other education, that you could stay on radar, so to speak, with other clinicians or applying registrars. So you can picture here a local life manual. One's for Armidale and the other one's for Tamworth. And this is a recent initiative trialled in the New England area to support registrars and primary health staff that have relocated to the area. And these manuals include some of the topics that we have discussed. So there's some history about the local area and the establishment of the towns, and includes things like the main shopping areas, simple things like radio frequencies. And I don't know if you, like me, but I really miss those being signposted when you go into a new town. Exercise, sport and recreation opportunities. You know, your registrars or new staff, you know, might have family visiting. What would they like to do with them on the weekends when they're visiting? Think about those little things that would really add to the experience of anybody coming into your town and region, so that when they are speaking to the next round of registrars coming through and their friends and colleagues, they can say, look, I had a great time in such and such. I learned about the tax and they did this for me, and you know, they knew I was interested in diabetes, so they hooked me up with the community of practice. I mean, what a great place to start. So have a little look at your orientation and induction processes with registrars and new staff and think where you can add value. That's what this session is actually about. There's workforce shortage. We know that there is there is a need in our areas for good quality registrars and doctors, and we want to do everything that we can as the PHN to support you in practice, you know, get the workforce that you need and have them staying around. So we probably have a little bit of time, and thanks everybody for listening. I hope that some of this you will have already known. You're in practice, so you know all about it. But I hope some of it has been beneficial to you. And I apologise that Casey couldn't join us today. If you've got any questions,
that was great. Thanks so much. There's lots of great tips there and information, and a copy of the presentation will be available in our education library after the session, as well as the recording. So I encourage you now, this is your time to pop your questions into the chat box, and Alison's will answer those. We've had a couple that have come in prior to the session, so thank you to those people who submitted those early. The first one is, Alison, placement of registrars. What if a registrar is placed in an area that, you know, it wasn't their particular first choice? You know, they might not have chosen that area to start with, but they're here now. How would the practice managers or GPs be able to support them in that situation?
Look, I think it's a good question, and you know, and there would be some awkwardness there, I suppose, knowing that there's a bit of discomfort. So to just do the best that you can. Like the situation might be that they're there for, I think it's usually six months or something. Is how can you as their team member maximise what they're going to get out of their experience with your particular patient cohort, their own education interests, what your area can offer them to enjoy outside of the work environment, and how you can like really connect them with the community. So I think if you started off with a list of those headings, you know, you'll come up with some things and have a chat with your own community members about how that they could really engage that clinician, so that that they can say, look, I was stuck out at Walk, I wasn't too excited about the idea, but I tell you now, I got to enjoy, you know, that they then have that good experience to share with with their fellow students or doctors or locums, or like anybody who, yeah, where that spreads, that really will have the biggest impact.
Yeah, really making them feel welcome. The second one was a practice manager just inquiring with establishing relationships with registrars. What if they're only speaking to their supervising GP and sort of not engaging with the practice manager or the rest of the staff in that situation? How could you handle that best?
Yeah, I think so. I mean, having already established a relationship, the practice manager and the supervising GP, I think if they, can agree that the practice manager plays a vital role in how the whole practice operates and, is across how the whole team works to get together. I think it would be important for the registrar to spend time with the practice manager. They certainly would be, in most cases, attending to rejected billings and have visibility of the education that might be coming through from the PHN or other avenues that they could link in and support the registrar with. As you said, making them feel welcome, part of the team, and making sure that the registrar has, everything that they need for every day, which isn't going to just be patient care. It's about learning how the business operates and how primary health fits into the whole system, and the practice manager is a big part of that.
Great, thank you. Alison's asked me to ask you, the audience, a couple of questions as well, and you can pop your answers in the chat box. So I'll just read those out and then I'll get to the other two questions that have come through. And then we'll come back to your answers. So this is your chance to have some input as well. So we'd also like to know if there's any presenters that do a follow-up survey. So when the registrar leaves your practice, how do you follow up? Do you ask, like, what ways do you ask how you can improve, and feedback from those registrars? How do you collect that? And the second one was in regards to your orientation and induction programs. What does that include and how's that working? Does it work well? Would you like to improve it, and how? So if you can put the answers to those into the chat box or questions box as well, we'll get to those in a moment. And there's a couple more questions that have come through for you, Alison. Do you know where I might find a trained medical accountant? I really like this idea.
Yeah, oh good. I'm glad that not everybody knew about that, because it was news to me when I found out about it as well. Look, I do have the names of some businesses that have specialised in that. So if you pass your details on, if they've already come through to Mel, I can get some information to you out of session, if that's okay. Yeah, fine.
Great. And registrars, where do you feel the best place to go about achieving successfully recruiting one or maintaining one in a practice?
Yeah, look so to attract and retain the registrar in practice. Yeah, like I think when they're finished doing the registrar rounds. Look, yeah, I think promoting the benefits of being a GP in your practice. So what does your practice offer that registrar when they are qualified as a doctor, as a GP? What can you offer them in comparison to other practices? Like, why would they choose your practice over another practice? Is it because of the workplace culture and the support for their own development? Is it because you've got a great collegial community feel when you work together? Because the practice is one thing, and them being a part of the community and have their family, potentially their partner and their family, feel welcome and want to stay as well. It's all of those factors. So you've got to tie it all in together. So and I actually had a story that I shared with our workforce manager not that long ago about a doctor he was in Tamworth, and he was at the hospital and had this grand plan probably established when he was at university. He was going to do X, Y and Z. So he moved, his family were well established here, the children were settled, the wife was happy, etc. And he focused, that didn't change from his original plan, I don't think, and it was a bit sad. He left the area. They couldn't find it. They had a beautiful house. Everybody was happy, as I say. Chased his career goal to go to a metropolitan area for the job that he'd always had his sights set on. And, I think more than 12 months later, quite regretting that decision because of everything that he's lost for his family and the community that he had, even though it didn't quite fit the career goal. So I think, you know, when you've got the opportunity to have these, create opportunities, actually, I should say, to have these conversations with any of your clinical staff and what they want. And sometimes it might not always be worth chasing, you know, the dream career goal, that there is so much other things in life that are really important. And a great work environment and a great community, you know, can be that. So have a think about that.
Yeah, sounds good. And I think it came up in a session the other night too, in regards to social media and website, like your Facebook page. And we've got a couple of practices that really promote their practice and what's special about it through those mechanisms. So something to think about as well. So I've got a couple of answers to the questions that we put out there. And yes, a lot of surgeries are doing the surveys before the registrars leave, and they're finding it really helpful. So that's really positive. That's great. I've also been asked to mention that this session we've recorded in our education library. It's called Employing an International Doctor, the basics presented by RDN, and it was recorded on the 17th of Feb this year. So that's also a good resource to check out in our education library on our website. So thanks for that. And we're right on time. It's 1:30 p.m. I think we'll finish there. I want to thank you, Alison. There was some great information that's come through this session, some really good tips. And thank you to everyone else for being here with us today. Just a reminder to complete the survey at the end for that valuable input for future events. And this is recorded. A copy will be available in our education library also. So thanks, Alison, and thank you to everybody. Have a lovely afternoon.
Thanks, Mel. Thank you, everyone.